Hey, welcome to the Go to Physio Sports Massage series. In today's lesson, what I want to talk you through is an anterior thigh mobilization. So this soft tissue technique, obviously we're still only treating the symptoms. We haven't found the true cause, but it's still very important to be able to desensitize these symptoms. You can use this for things like knee pain, anyone who's on their front and you extend, you flex their heel to their bum and they get low back discomfort. This might be something that you might consider using. Anyone you want to improve their hip extension, but obviously remember, we still need to build that graded exposure program. So with that said, let's show you some of my favorite techniques for the anterior thigh sports massage techniques. Okay, so now we're going to do the anterior thigh. So the quadriceps in particular, anyone that has knee pain, decreasing the tone in these tissues, if there's a lot of nociceptive input coming from these tissues that maybe is contributing to this pain experience in the knee, then very often if we can get some kind of modulation from these tissues, the athlete can experience quite a dramatic decrease in knee pain, okay? Especially the vastus lateralis, from my experience, that tends to contribute a lot to this pain experience. Once we get that modulation through that, then very often we can change symptoms. Now, as always, we want to make sure that we correlate this with some kind of objective assessment as well. So we're not just treating the person on their letting them lie on his back for half an hour. So I would very much be the case of, okay, we've identified, for instance, with Pete that he had decreased knee flexion. So if you pop on your front, Pete. So for instance, when I done a knee flexion test with Pete, okay, we found that, okay, he lacked a little bit of knee flexion, okay? He had increased protective tone around that quad. So if you pop on your back again, Pete. So now what I'm gonna go about is trying to decrease that protective tone around that quadricep, okay? So again, just check with your athlete, you're not allergic to any oil or anything like that, Pete. So you just put enough oil on, okay? Again, you will get to know yourself, the kind of oils that you like, etc. You don't necessarily need oils sometimes if you just want to bring about a decrease in protective tone. But what I will usually do is I'll just start, and all I'm doing here is I'm feeling for any particular protective tone in this tissue, okay? So as I sink through the skin here, okay, that tissue should be nice and springy, okay? So I can feel along that tissue, okay? And then usually you'll find that there's one or two places that just doesn't spring as nicely, okay? So here the tissue is nice and soft, it's got a nice end feel, and as I come down to here, it's just that end feel just comes a little bit quicker, okay? So it's not as springy, the hair is a little bit tight. Now it's not too bad, but it's not as good. So if I'm going to spend the majority of my time here trying to bring about some kind of modulation, I'd be a little bit more wiser maybe to spend the majority of my time here, okay? So if I want to influence this tissue, then I would start a little bit lower and then come through the tissue, okay? So if this is the spot I want to actually influence, especially those deep receptors, I want to be sinking about here and then coming through here. So I'm not trying to sink actually on the spot that I feel that there's more protective tone. So all I'm going to do is I'm just going to sink into the tissue and then I'm just going to come through the tissue here, okay? I'm just nice and steady. I'm just building my pressure. So this is kind of the area I want to work on for argument's sake. I sink here and then I just come through, and then you can see I'm pushing, okay? And if you want to just put the camera down to my feet here, as I come through here, what I'm actually doing is I'm pushing off my right foot and I'm actually accepting weight onto my left foot as I push through here. So I'm getting quite a bit of force through that forearm / elbow, and I'm actually just pushing my body weight through, okay? So my back's not doing anything here. I'm using my full body weight just to push through that forearm, okay? And then what I'll do then is I might just internally rotate the femur slightly. I'll sink into that tissue and then I'm just going to come through here as well, okay? And then I can feel that there's a little bit of protective tone there. Again, I'm not going to the point where it's absolute agony for the athlete, okay? Because I don't want them to wince and tighten. We need to be hitting some deep pressure receptors sometimes, okay, potentially. So we might want to get deep sometimes, but at the same time, if I feel that, okay, Pete's face there is really, really tightening, his whole body is tightening, then my depth probably is not appropriate, okay? So I just want the athlete to be able to breathe through the movement as I bring some type of modulation to these tissues. And I can feel here he's a little bit tight. So again, I'm just helping that tissue, give it a novel stimulus, okay? And then I'm just helping that tissue experience some kind of loading here, okay, as we do that, okay? And it's beginning to soften a little bit, so I am getting some kind of change here, but again, we want to make sure that that relates to that athlete, especially with terms of range of movement, etc. Okay, so that would be the front of the thigh. I would use my forearm predominantly. If I wanted to, I could come in, and again, what I like to do here is I like to put my elbow into my waist here, okay, which keeps this kind of degrees of freedom limited, and then I'll just come through here with my forearm, okay? So I'll keep this locked in, and then I will just generate tension through here, okay? So then, you know, if I had to use my hands, I would use that, but for the majority of athletes, you know, I think I can get the majority of the quads and the vastus lateralis through my forearm. But if there was one particular spot, I might just get that elbow tucked into my waist here, okay? And then I'm almost pushing with this part into that, okay? So this hip here almost pushes my fingers through, okay? So my fingers aren't actually doing it, aren't actually generating the force here. It's actually my leg again, okay? And then we can get that particular spot. Then the other thing I might do in this situation with the vastus lateralis is I might get Pete lying on his side as well for the lateral thigh, which we'll cover in a different video, okay? So that's your anterior thigh. Make sure you get the vastus lateralis, you know, the rec fem. You know, sometimes that may need a little bit of hands-on work, VMO, but in particular, especially with a lot of knee pain, just doing some kind of hands-on work to the vastus lateralis can bring about some kind of modulation pretty quickly. And then as always, we need to build on top of that as well. So it's no good just treating this tissue now and sending the athlete off. We need to understand why we're doing it and how this fits into their bigger picture. Hey, so I hope you found that technique useful. As always, please respect the 80-20 rule and understand that we're just treating symptoms here. We haven't found the true cause. If you're interested in learning more about how to find the true cause, head over to www.thegotofysio.com. I've got plenty of tips there for you and loads of content to help you become that go-to therapist that helps people who have failed traditional approaches. See you next time.